Fibroadenoma. Now, fibroadenoma is a benign biphasic tumor in which there are two types of proliferation. There is glandular proliferation as well as there is stromal proliferation. Therefore, the name is biphasic tumor. And now this stromal proliferation occurs from the intralobular stroma. So you can see this is your main ducts. Now this duct will further give rise to terminal duct. Okay, the terminal duct is there, and terminal duct now is attached to lobules. These are the lobules. Okay, so this is the lobule, this is the terminal duct, and this hole is known as terminal duct lobular unit. Now the stroma which is involved in the case of fibroadenoma is intralobular stroma. Now there are two type of stroma. There is interlobular. The stroma which is between the two lobules is known as interlobular stroma. However, the stroma which is just around the lobule and between the spaces will be intralobular stroma. So this is the tumor in which there is proliferation of the stroma of the intralobular stroma. When you talk about the stromal tumors of the breast, we have two stromal tumors of intralobular stroma. These are fibroadenoma and phylloids. Here we are discussing about the fibroadenoma. Now, how does the patient presents? Now, this is the most common breast tumor of the adolescent and young women. Okay, in totality also, it is the most common breast tumor. It is a type of a stromal tumor. Okay, so this occurs mostly in adolescent and young women, especially around the age of 25, 20 to 25. This is the age. And how does the patient present? Patient will present with a painless, firm mass which is very small in size. Mostly it is less than 3 centimeters. Mostly it will be around 1 to 2 centimeters only. Okay, but in some cases it can also grow to a large size. Okay, but mostly it is around less than 3 centimeters. It is a very painless, mobile, slow growing mass which can be solitary. One can be there, it can be multiple also, it can be bilateral also. It is also given the name breast mouse because of the how mobile this is. Okay, so it is given the name as breast mouse. This fibroadenoma is a hormone sensitive type of tumor. That means during pregnancy this will increase in size, and after menopause it will decrease in size. Now going to the morphology, if we see grossly, so if we receive any specimen of lobectomy, okay, of excision of the fibroadenoma, okay, so how will it look like? Now this is a sharply circumscribed and freely movable tumor. Now this is not totally encapsulated, it is circumscribed, it is well circumscribed tumor, and it has a very feel is rubbery. So why it is rubbery? Because it has a very prominent stromal component, therefore the consistency is rubbery. And one thing is important is when you cut this tumor, the nodule, they will bulge above the surrounding tissue. Okay, they will just bulge as if they were contained in a space. So they will bulge out, and they also contain slit like space. You can see over here there is a slit like space, so this will also be present. Going to the microscopy. Now in microscopy, again, if you see, it is well circumscribed tumor. It is not capsulated, it is uncapsulated, but it is very well circumscribed. As we already told that it is a biphasic tumor. That means there are two parts. There is a glandular part and there is a stromal part. Now stromal part is, there is almost uniform cellularity present in the stromal part. But what about the glandular part? Now in glandular part, if we are discussing, there are two types of the growth patterns. If you see over here in this diagram, you can see the two growth patterns. Now one is your intracanalicular type. Okay, this is your intracanalicular type, and then there is a pericanalicular type. So in what happens in intracanalicular type, the stroma grows and pushes the glands into formation of linear linear branching system like this. It will compress the glands. Okay, therefore the lumen of the gland will not be visible. However, in pericanalicular type, you can see the glands, they are not compressed so much. So this is pericanalicular type. So you have two parts. You have intracanalicular, in which the glands are compressed into linear branching structures by the proliferating stroma, and then you have your pericanalicular type, in which the glands, they retain their open lumina. So one more thing to remember, because it's a benign tumor, and there will be intact myoepithelial cell layer will be present. So now types will depend upon certain things. Okay, there is a type known as juvenile fibroadenoma. Now what does it mean? Juvenile word stands for young population. Okay, so sometimes you can see the fibroadenoma in a very young population, like 15 to 20 years of age. Okay, even 13 years of age. So that term is known as juvenile fibroadenoma. Here the growth of the tumor can be more. It is benign, totally benign, but the term is given juvenile fibroadenoma. Then there is a complex fibroadenoma. It stands whenever you see any cystic areas inside the fibroadenoma, that is fibrocystic like changes which are present in the fibroadenoma. Then you have cellular fibroadenoma. Now cellular fibroadenoma is given when the stromal hypercellularity is seen. Stroma should have a uniform cellularity in case of fibroadenoma, but if there is hypercellularity, then the word cellular fibroadenoma can be used. Now as such, if you talk that these fibroadenoma is totally benign, but and it does not increase any risk of carcinoma of breast, but certain things such as if there is cellular fibroadenoma, if the fibroadenoma presents in a later age, so these are some features which should be cautious. Okay, they have a slight increase in the risk of breast carcinoma. Now treatment, generally the patient, if does not have any visible deformity or such, then the patient goes for conservative treatment only. However, if the size is big or there is certain other problems, then local excision can also be done. So this was all about fibroadenoma. We will discuss phylloids tumor in the next video. Do like, share and subscribe to this channel if you like these videos. Thank you.